This BTOG meeting, which has been, as usual, a fantastic experience, lots of enthusiasm and expertise here and teamwork. And that's one of the themes of my talk on how to diagnose and investigate patients quickly and effectively achieving an accurate stage and diagnosis in a good time frame. Because one of the things that I think is the most important thing, and what I emphasised in my talk, was how incredible big difference one can make by having a great team with enthusiastic experts in that team. That seems to be the principal driver. Of course, we also discussed about the problems with capacity versus demand, and we know that despite the fact that age standardised incidence rates of lung cancer are falling quite sharply in men, the crude incidence, which is what we have to actually deal with in our clinics, is going up. In the last 10 years, it's been going up by about 10,000 new diagnoses per annum for the last 10 years. That's a very significant increase for the teams. At the same time, when you look at our capacity to deal with these, well, certainly the human resources are very limited indeed. Where is that worse than in clinical radiology? And a 2018 consensus taken by the Royal College of Radiologists showed just that. It showed that we were spending almost double the amount of money on locums and outsourcing of radiology that would be required to actually fill all of the full-time posts that are currently underfilled in the UK. And there's a problem across the whole of the workforce in the lung cancer MDT. So it's a real problem with the capacity. And then if you look at equipment, which is also very important, if you've got lots and lots of equipment, then you're more likely to investigate and stage people quickly. And to be fair to the government, they have improved the amount of PET CT scanners that are available, which are very, very important, although we're still under-provided compared to Europe. And also they've improved things like treatment facilities, such as the radiotherapy machines. But one thing that they haven't done adequately is increasing the number of CT scanners, which are absolutely pivotal at the beginning of the lung cancer pathway. I showed some figures to show just where we compared with respect to other developed countries. And per million population, we have around about half the number of scanners that they do in France, less than half that they do in Italy, a third that they have in Germany, and 1/5 that they have in the US. So one of the reasons I think that we diagnose people late is because people don't get scans early enough, and if you haven't got many scanners, you don't scan many people. So it's also linked to frequency of early diagnosis. So we need to improve that, because all the government have done so far is announced a replacement programme for the older scanners, which is not sufficient to plug the gap. And then the other thing that's always a problem when you're trying to run a rapid pathway is what system you use. We're really lucky because we have this national priority, which is the National Optimal Lung Cancer Pathway. We're trying to support people in implementing that pathway in a variety of different measures. And the most recent thing is that we've introduced these diagnostic standards of care to try to ensure that people are absolutely clear about what sort of tests they should be doing in individual circumstances, and in particular understanding why you need to use bundles of tests at once rather than do sequential tests, which then takes a long time before you actually get to the diagnosis and stage. And finally, there is often a spanner that comes into the works. If you suddenly have to have an advance, which means that you have to do different things, more complicated things, to make sure your patients are treated correctly, then that can lengthen the pathway, and you have to think of a new solution to try and improve things. One of the concerns is the need to test for more and more mutations to guide targeted treatment, and that can take time, and we need to make sure that that is done rapidly and doesn't slow the pathway down, so that patients get treatment quickly. And then finally, when you've got a very big national initiative, such as the CT screening programme for lung cancer, that can swallow up some of your capacity. So again, you have to work out how much effect that's going to have on your turnaround times for tests and your ability to diagnose and stage people quicker.